Box 4.1 identifies the code of ethics for nurses. A couple of things include having compassion, dignity, and respect for patients. The nurse's primary commitment is to the patient, promoting and advocating for the patient's rights, health, and safety. That the nurse has authority, accountability, and responsibility for their nursing practice. Also, the principle of autonomy is important for the fundamental right of self-determination. Looking at the basic questions for ethical decision making can be helpful in order to review a situation. What do you know about the patient's situation, the patient's values and preferences, any assumptions that may need more data to clarify the facts? What are your own personal feelings and values about the situation, and are those in conflict with those of the patient? The bioethical terms of psychiatric nursing are also defined in this chapter. Probably seen these before. Autonomy, beneficence, justice, non-malfeasance or non-maleficence, paternalism, veracity, and fidelity. Understanding the scope of practice for a mental health nurse can be helpful in identifying what the role is, such as case management, milieu therapy, medication management, crisis interventions, psychiatric rehab, promoting self-care activities, doing intake screenings and evaluations, health promotion and maintenance. To further understand psychiatric mental health nursing, looking at the standards of practice on box 4.3, looking at the psychiatric mental health nursing assessments, nursing diagnoses and outcomes, identifying planning strategies and alternatives to expected outcomes, implementation, which would include coordinating care, identifying health and safe environments, collaborating with interdisciplinary team members, identifying specific therapies that will be important, such as pharmacological, biological, and complementary interventions. Milieu therapy is a big point as well to help maintain a safe and therapeutic environment. And therapeutic relationships and counseling, which is helpful in terms of coping abilities, fostering mental health, and preventing mental disorders and disabilities. And then psychotherapy is what a advanced practice registered nurse would focus on. And then evaluations for the generalist psychiatric mental health nurse to help identify expected outcomes. What's important to note here is really the difference between a generalist psychiatric mental health nurse versus an advanced practice registered nurse. So there are differences with the advanced practice. As I indicated, they can do psychotherapies, more specific case management, clinical supervision, consultations and liaison work, as well as psychopharmacological interventions. The standards of professional performance for the generalist nurse are identified in that table 4.1 that talks more specifically about the leadership roles, the quality of practice, and collaboration with healthcare members.